The Scour test is an excellent test to really get an idea of the hip acetabulum anatomy. Dr. Stuart McGill's done a lot of great videos on this showing how he tries to feel out the inside of the hip or the acetabulum by doing the Scour test. So there's a few things you can do with this. One, the Scour test, we're looking for hip labrum, which is the protective lining in the hip. How well or what the integrity is of that. So you can add a pressure, pressing down, so I'm pressing through his femur right down into his hip and pelvis, and we're seeing, is there any tightness? Is there any pain here?
Nope.
Nope, no pain here. So ideally, or this suggests that his labrum's pretty well intact. We can also move around here, see maybe what the anatomy of that hip socket is like. Right here, I'm starting to feel restrictions. I just see he's in quite a bit of hip flexion here, showing that perhaps he has an acetabulum that isn't covering all around the femur's head, allowing it to be maybe more in this position, allowing more hip mobility, suggesting that maybe he could be someone that can squat deeply without having a ton of that pelvis motion. Some, I'll be moving around and there's a lot of restrictions, a lot of tightness there, a lot of things that aren't allowed to move freely, and that might mean that that hip socket is a little deeper, causing any rotation or motion to occur at the hip and also to have the pelvic move simultaneously. So for him, he's able to move freely, likely able to go into a deeper squat pattern, versus someone, if you do that Scour test and there's more restriction, that could suggest that the hip is a little more encompassed and not going to be able to move as freely, likely due to the acetabulum anatomy and configuration.